Good morning and welcome everybody to today's webinar, Streamline Requests and Connect Operations and Services. My name is Kelly Keeblebeck and I am the Product Marketing Manager for Healthcare at Accruent. I will be acting as moderator for our session today. And now I'd like to introduce today's speaker, Todd Stewart. For more than 20 years, Todd has assisted healthcare systems in achieving continuous process improvement and operational excellence by spending time in hospital settings, on nursing floors, and in operational departments. Todd leverages lean thinking and technologies to improve workflow processes, operational effectiveness, patient and staff satisfaction, and safety across the continuum of care. With that, I'm happy to turn it over to Todd.
Thanks, Kelly. Good morning, everyone. Thanks for joining. Really looking forward to the next 30 minutes and stepping everyone through at a high level what Accruent Healthcare has been up to with regards to how we help organizations streamline requests and connect the various operations and support service lines to drive a number of different efficiencies throughout the healthcare system. So just a brief agenda across our next 30 minutes. We'll be talking about how we go through that consolidation of support service requests. We'll take a high-level look at increasing productivity and utilization, how these various workflows are automated, ultimately yielding us valuable evidence-based data that we can use to improve business decisions and improve outcomes going forward. And we'll close out the session this morning with a live Q&A. Hopefully, people come up with some good questions that we can dig into. So, as everyone knows, a hospital is a very busy place. Everybody's in motion. It is a highly mobile environment, and ultimately, the staff in the hospital, doctors, nurses, administrative staff, clerical staff. People need things. Needs arise all day, every day, 24/7. You know, whether it's something that the environmental services needs to deal with, a broken piece of clinical equipment on a floor, any type of a physical plant request, you know, you name it, these things all arise. You know, a critical care bed, the headboard won't go up. So as the end user staff are running into these various issues, what Accruent Healthcare sees a lot of times is disparity across the continuum of care when it comes to how all of these different types of requests are captured and then subsequently routed to the right people to take care of the particular situation in a responsible or responsive amount of time. As Kelly said, I, along with my colleagues, spend a lot of time looking at these challenges in hospitals, and it's the number of different systems or avenues that any one healthcare system needs to deploy to be able to capture all these different types of requests and try to wrap their arms around them and really start to understand where is my demand coming from, how am I doing at meeting service level response times and service level agreements. It's challenging because of all the different modes of accessibility. Some requests could be placed through computer systems, some maybe by phone, others you stop the technician in the hallway and, hey, can you give me a hand with this? Others might go to a call center or to a phone operator or a switchboard. What Accruent Healthcare is all about is being able to help systemize and standardize all of these different types of support service requests. And as you really start to think about it across the continuum of care, there are a number of service lines, support service lines that can all benefit from a way to systemize and standardize how requests are placed. So, you know, at the end of the day, these are just some examples of the types of departments who all ultimately provide a level of support service out to your end customers. And your end customers can be your own staff, it can be the patients, it can be the patient's family and friends. It really, you know, it never ends in terms of who needs what. So one of the things that we've gotten really good at doing is providing tools and capabilities that really, truly consolidate all of those different types of requests and make them readily accessible in the palm of your hand through a smart mobile app, as well as through a web-based application, and really ultimately creating a one-stop shopping mentality or a single pane of glass where all of those different request types can be accessed, simple button clicks or thumb presses to submit those requests in order to really start to gain what we like to call real-time situational awareness and operational intelligence. So if we understand where all of our demand is coming from, because it's by nursing unit, by hospital, by outpatient clinic, and then by user, we can start to really identify where we need staff, where we need resources to make sure that we are meeting that demand and better connecting the various operational departments, that are providing care, that are providing some level of deliverables to the patients, and the support services departments that really need to keep the hospital going. Without all of the different departments, clinical engineering and facilities and EVS and equipment distribution and IT and supply chain, the hospital would come to a screeching halt. The doctors and the nurses, the frontline caregivers, they need stuff. So the ability to give a portal of entry for them to request what they need with ease and simplicity, and allowing those requests to get to wherever they need to go to quickly and efficiently will allow for quicker turnaround times on service response. So instead of living in a world where there's a lot of service recovery, hey, the nurse called and needed this or that, and, fingers point, I didn't get the phone call, I didn't get the email, you didn't actually leave a message, I don't really know how long it took. All of those sorts of things start to go away, and we move from service recovery to really focusing on service level response times. We look at compliancy, we look at increased patient and staff satisfaction. If we're able to properly manage the capture and the assignment of work to people from the point of need to the point of fulfillment, we are ultimately going to create a far more efficient ecosystem around the different levels of support services that are required to provide exemplary patient care. What we call this application set is I need it. And it goes back to the earlier slide where people need stuff. In our personal lives, we need things. If you need a cup of coffee, you can go to your Starbucks app and say, I want, a grande latte with whip. And, you get a notification when your coffee is ready from Starbucks. Well, we take the same approach, only instead of ordering a Starbucks cup of coffee, it might be a spill clean in a room. It might be, any other type of support service request. So request workflow really starts with the request capture. And we're talking about a bunch of different ways that requests can actually be captured. Some of them could be on demand, like examples of a nurse or a doctor or a unit clerk going into the web or the mobile app. Requests can be generated from the Internet of Things world, sensor-based inputs, passive RFID, real-time location systems, Bluetooth Low Energy, being able to understand where things are that can then generate requests to have something happen. Requests can come from software schedules, computerized maintenance management systems like TMS and Asset Enterprise, where there's a number of scheduled requests that generate work orders or work assignments for preventative maintenance. So the ability to capture all of those different requests ultimately drive workflow. Workflow is the ability to take something that needs to happen and intelligently assign it to someone and hold them accountable so they actually get it done. So in order to drive workflow, we incorporate things like a rules engine, auto assignment capabilities, dispatching and escalation pathways, all done through web applications and all done with prioritization. if we're going to set service level expectations and service level agreements with our end customers, we really need to know, how much demand is being placed on us departmentally, what type of staffing we need, and then more importantly, what's my mechanism going to be to notify people when work actually needs to get done. So workflow is very, very important in terms of being able to take those requests and actually drive them through an engine and then track how we're actually doing to complete the work. So once I have my requests and I run it through my workflow engine, now I want to track progress. I want to be able to know how my staff are doing. I want to know how my biomeds are doing at fixing equipment as corrective maintenance repair requests come from the floors. I want to know how my linen team is doing when a linen cart on 6 West Surgical Unit didn't get filled this morning by mistake, yet they're out of Johnny Coats. How long did it take to get more linens or a new linen cart back up to that particular unit? So the ability to track and start to understand what's going on with all of these different types of requests and how we're doing. And then ultimately, I want to be able to resolve. When things are running great, we don't need to be focused on every little minute aspect of all of these different requests that are coming in across the organization or even across a specific department. But what we do want to look at is when things fall through the cracks. If I have a service level agreement for, we'll say, equipment distribution, and it's a routine request to get an infusion pump to a patient floor within 30 minutes, and I see that there are some instances of IV pump delivery requests being delayed. I want to start to identify those and drill into what the delay reasons are, and then actually go share that information with my end customer so that we can work together to make sure that in the future those delays don't occur. So understanding what's going on in situations where we're not doing well with efficiency and with workflow automation is where we look to get into resolving what happened. And I Needed Web and this back-end workflow engine really act as a record of truth to help us identify and account for what happened and when, and how can we move forward to ultimately improve it going forward. So I want to be able to improve PM completion percentages. We're always looking to improve patient satisfaction, demand and forecasting, which drives into resource planning. If I've got a staff of 16 FTEs that I need to load balance correctly across a 7-day-a-week work schedule, wouldn't it be great to be able to know what my demand is across my department on a day-to-day basis, averaged out over time, so that I can really, truly staff appropriately where I don't have idle staff sitting not being properly utilized, or I don't have staff that are overutilized that just can't keep up with the workload. So, ultimately, if we continue to think about request fulfillment in a closed-loop mentality, it's a constant spinning cycle that just goes around and around. And ultimately, from a lean methodology perspective, what lean teaches us to do is to look at what we did yesterday and figure out ways that we can carve out, little bits and pieces of non-value added time so that tomorrow we can do that process even better, even more efficiently. So, the ability to take this request workflow and continually look to identify opportunities for improvement is really what the entire thing is all about at the end of the day. So an example of I Need It. We have this is a screenshot of a typical example, for a facilities repair. So if a nurse has, this is how we capture requests, a portal of entry, web-based. It's all about ease of access and ease of use. So the nurse clicked on, a facilities request, and then, graphically pleasing icons, pictures worth 1,000 words, the ability to help people identify quickly and efficiently, where to go and what to do so they can just generate their request. In this case, it was a patient room, too hot, too cold, that was clicked on, which takes them to a confirmation screen where they can simply put in a request priority. They can put in a room number, and maybe a note to the technician who's going to come fix the situation, and submit that request. Very much like ordering a pizza on Domino's.com or ordering that cup of coffee in the Starbucks app. You know, we ultimately want to give that instant gratification. Hey, thanks, we got your request. We're going to make sure it routes to the right person or the right department, meaning that you don't have to think about, oh, I wonder if that has to go to Bill or Ted or Sam, or, you know, what the work order type is that needs to be created. Our workflow engine will actually take care of all of that for you. And it's designed to create that real-time situational awareness so that everyone knows what to do next. The end user who put in the request can be kept up to date with request status. The HVAC craft worker who needs to take care of this room too hot, too cold request knows exactly where it came from, knows some of the details, knows who placed the request, and can get in contact with that person to say, you know, hey, I'm on my way, and they can do all that without ever having to pick up the phone. The way we look at I Need It, it's really like air traffic control. You know, there are planes landing and taking off all day long in a hospital, and it's, instead of it being airplanes, it's all of these different types of requests that all get generated and all need to be dealt with, running through all these different levels of complexity around workflow optimization. You know, when you think about, you know, getting on a plane and going on a trip, you know, I fly 100,000 miles a year, and my number one concern is air traffic control. Am I going to, when we push back from the gate, are we going to get the captain coming on and say, oh, you know, ATC is sequencing us into Charlotte or into Atlanta, which means I'm going to get delayed. So, you know, what we really want to do is avoid the delays, keep the workflow running on time, and the only way to really do that is to truly understand where all the planes are, where are all the different requests, and what status are those requests in, which ones can I land, which ones need to be assigned, which planes are going to end up getting delayed, and how do I let the people know which requests those happen to be so that they can make informed decisions on what to do next. Maybe they need to go let the doctor know, hey, that IV pump that I just ordered, there aren't any right now, so we're trying to remedy that situation. You know, the ability to create real-time situational awareness via this air traffic control mentality is really what the core of I Need It Web is all about. I mean, that's workflow automation at its finest, is following that air traffic control mentality. Once those requests are captured and we run them through our workflow engine, we have to be able to track them. We have to be able to hold the staff responsible for responding to the requests accountable for getting that work done. Remember, it's a highly mobile environment. People are always on the go. So the ability to leverage mobile applications, for those of you that are TMS users, TMS Sidekick, great way to be able to access all these different work regardless of the segment that you're using. Asset Enterprise users can use Mobile Tech, same thing. It's a way to be able to get a request from an end user to someone who needs to fulfill that request quickly and efficiently so that all they have to do is act. All they have to do is respond, document, some thumb clicks, and it's real-time situational awareness that drives operational intelligence. We know where the request came from. We know how long it took for the technician to respond to it and ultimately close out the request, all without anybody having to do anything other than their job, as efficiently and as productively as possible. So the improvement side, being able to ask yourself these questions. You know, how many requests are coming in? What type, from where, and when, and how often? Are we being proactive or reactive? You know, where are delays coming from, and what's the cause of those delays? Are we properly staffed to meet demand? You know, what are our turnaround times? How well are we doing departmentally at meeting that demand and meeting those SLAs? I Need It gives us the ability to identify and resolve those situations. So if you've got a nursing unit with 35 or 40 nurses on it, it's a busy nursing unit, you know, they need access to the status of all their different types of requests. So we give them that ability to help resolve situations on the fly, on the patient floors, without having to make phone calls, without having to run around, you know, trying to track people down and send in emails. Everything is front and center for them to be able to understand and resolve via real-time status updates. And that's just the continuation of real-time situational awareness and how we tie the request to workflow to resolution. And then ultimately improve. We want to be able to use evidence-based data, real-time key performance indicators, metrics, you know, true business analysis to start to quantify how are we doing as a department, how are we doing as a support services organization at meeting our goals and objectives. You know, every biomed department has preventative maintenance work they need to complete on a monthly basis. You know, Joint Commission wants to see completion rates on equipment at 100% unless it's under an AEM program, and even that's at 90%. How are we doing at meeting that? How are we doing it at making sure that rooms are getting turned over and cleaned in an appropriate amount of time, or that mobile medical equipment is reaching its destination, its point of need in a relative amount of time? So, you know, the back-end analytics that help us continually improve, continually identify opportunities for where we can do better tomorrow than what we did yesterday is all part of the deliverable that I Need It represents. So again, in summary, you know, all of these different types of service lines, all of these different types of patient-related support requests, you know, the ability to consolidate them into a web or a mobile app is literally there for the taking. This is something that Accruent Healthcare is extremely excited to bring to our client base. It is a very scalable solution set. You don't have to do every single workflow in one shot. Most of our clients will step through them very, very methodically and rolling them out at certain points in time as needs are identified and as time permits. So before we go into Q&A, I did want to mention that the part 2 of this is a 3-part webinar series. Part 2 is going to be focused on a specific type of workflow that I Need It focuses on, and we've got a number of client successes around, which is driving equipment availability up and response time down, while also ensuring PM compliance completions. The title to this slide was missing that component, but it's a 1-2 combo where, you know, we want to make sure that the right equipment is available at the right place based upon demand, while at the same time making sure that that same equipment is meeting its PM compliances. So hopefully many of you can register for that session, and looking forward to stepping everyone through it. And with that, I'd like to turn it over, Kelly, to any Q&A that we may have coming into the chat.
How is pricing for this application determined?
Typically what we'll do is we would have your account executive reach out to you and start to take a look at, you know, what are the different types of service line request types that you're looking to consolidate, and figure out, you know, what a good subscription pricing model would be. And there isn't a direct answer to how it's priced, other than it is priced by what I'll call workflow. You know, whether it's clinical engineering or facilities or EVS, equipment distribution. You know, we scale the pricing based on the number of different icons, if you will, that you would see in I Need It.
How does I Need It interface and work with TMS? Is it an add-on or a standalone interface?
So that's a great question. It is a seamless interface, and it's actually, I don't even want to use the term interface. It's fully integrated with TMS. So let's say if you have 4 segments, you've got EVS and biomed and facilities and, you know, and another one. Traditionally with web requester, that would mean 4 web URLs, 1 for each web request type. With I Need It Web and its modern integration capabilities directly into TMS, everything is streamlined so that you have 1 URL and all of the segments are represented duly on one screen. And as those requests are being generated by your end customers, they are seamlessly being directed into the appropriate segment. So it's literally a seamless integration, and it works extremely well from request capture all the way through out to request fulfillment in Sidekick.
We have another question. How long on average does it take to implement a system like this?
Well, we get asked that question a lot. We were just at Advocate Health System yesterday in Chicago, and that was one of the questions that came up. And the answer is it really does not change from one conversation to another. It all boils down to the number of distinct workflows that we're looking to enable through I Need It Web. You know, I've seen implementations take as little time as 45 days to, you know, over 6 months, depending upon the size and the complexity and the number of moving parts. You know, the cool part about I Need It Web is from an end user, you know, customer perspective, you know, your end customers, very, very easy to train on. You know, our services team are awesome at working with the nurses. In-service training under 2 minutes. It's point, click, 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 done, got it, you know, sign their in-service training, and away they go. Where we spend a lot of time is really understanding how do we take those requests and intelligently route them where they need to go. Do we use auto dispatch? Do we use manual dispatch? What's the mode of notification? Is it going to be Sidekick or Mobile Tech, or is it going to be a pager to someone who's on call in off hours? So we spend a lot of time, you know, making sure that the actual workflow component of request fulfillment is well defined and configured properly, so that when we take a client live, the system actually works well right out of the gate.
Looks like we have time for one more question related to notifications in biomed. How do you handle multiple programs and multiple vendors? Some of them are PC-based, some of them are SaaS. How does all of that come together?
Well, I'm not 100% certain I understand the question in totality, but I'm going to see if I can maybe take a stab at part of it. So when we think about request fulfillment specifically around biomed, you know, let's use a CT scanner or an MRI suite. An MRI suite is probably a good example. What ends up being the challenge there is the MRI suite as a whole. You can look at that as an asset, but we all know that the MRI suite is comprised of a number of different things that actually equate to providing that type of a scan. So when we talk about workflow configuration and process mapping, you know, an example that I can give in how we tackle that would be instead of trying to ask the end customer, well, you know, which thing is it? Is it the control system? Is it the actual scanner itself? Is it the bed? You know, what piece is wrong? Instead of asking them that, what we can do is use some user-defined fields in the confirmation screen of how we capture the request itself. And maybe we say it's, you know, it's MRI room 1, MRI room 2, and get that level of information to the, you know, to the rad tech who's potentially going to go out and deal with that situation. That may not be the best answer to the question, but it's, you know, I was a little confused by what was actually being asked, and if that particular person wants to follow up afterwards via email or phone, I'd love to talk further about it.
There was one more question that came in. Is this a replacement to TMS web request with the ability to generate reports and compile data in a separate dashboard outside of TMS? Is that accurate?
I don't think it's, well, yes, it's designed to replace or basically to augment web requests. Excuse me. So as I had said earlier, if you have multiple segments, that equates to multiple URLs for TMS web requests. So the ability to consolidate all of them into one and literally create that one-stop shopping mentality, it's an easier way to support your end customers when it comes to capturing requests. In terms of how everything routes through TMS and how reporting is done and how dashboarding is done, none of that changes. it actually makes it even more efficient in terms of request capture and analyzing, all of the different types of data elements that are captured. How often are the requests coming? What are they for? Where are they from? How long are they taking? All of that reporting and all those analytics that are already in TMS continue to get leveraged the way you'd be leveraging them today.
Wonderful, Todd. It looks like we're out of time. So if you do have any questions that you would like answered that we did not cover, please feel free to send us an email at sales@accruent.com. Thank you very much for attending, and thank you, Todd, for sharing all of your experience. Again, thank you, and have a great rest of your day.